Welcome to Trinitas. It is our intention in this video to help you become familiar with our clinic, to understand how it operates, and to help you learn how to take full advantage of the services we offer.
We are a large clinic that has a staff of well-trained healthcare professionals and clerical staff, each of whom is dedicated to a mission to provide you with quality mental health care that will truly help you to help yourselves. This clinic is part of the Department of Behavioral Health and Psychiatry, which provides a comprehensive range of mental health and substance abuse services. It is one of the larger departments of its kind in the state.
We consider treatment to begin at your first moment of contact with us. This contact may have come from a phone call by you, a family member, a friend, or a referring agency. We may have learned of you via information that was mailed or faxed to us. You may have just walked into the clinic. No matter how you were referred, we consider your referral to be very important.
We gather information at the first contact that will be vital in helping us to determine what services we can offer you. It is important that you are honest and thorough in the information that you provide us. It will be at this time that a determination will be made whether we are the appropriate service for you. For example, you must be at least 18 years old and not in immediate need of inpatient or emergency room treatment.
A clinician at Trinitas does a variety of tasks, individual, group, family therapy, and also evaluations.
Thank you very much. What can a consumer expect from treatment with you?
Treatment here is on a short-term modality. What the consumer can expect is 12 sessions of individual therapy, or if it's a group setting, then it could be a time-limited group on a variety of different topics.
What do you expect from the consumers to provide to get the best results from treatment?
I expect from the consumers effort. I want them to be able to commit to their treatment. I want them to be able to talk about their strengths and weaknesses and give me time to deal with their issues.
Thank you very much, Louis.
Thank you.
If you do not keep your appointment and are running out of medications, you may walk into our reception area and request to be seen for a medication monitoring visit. You may have to wait several hours to see somebody this way. Whenever possible, we arrange for you to see your regular psychiatrist.
Hi, my name is Dr. Benjamin Chu, MD. I'm the Medical Chief of the Adult Ambulatory Services and the Partial Hospital Program at Trinitas Hospital. And this is the Department of Behavioral and Psychiatric Services.
What does a psychiatrist do here at Trinitas?
The psychiatrist is an important member of the treatment team. And this includes the clinicians, the nurses, and the social work assistant. The psychiatrist, in cooperation and coordination with the clinician, performs the psychiatric evaluation, formulate the diagnosis and the treatment plan, and work with the clinician and the consumer in starting their treatment as soon as possible.
What can a consumer expect from treatment with working with you as a psychiatrist?
The consumer should expect the full explanation of their illness, the full explanation of the risks and benefits of the medication, and also with their permission, we contact the family to ask their help in providing complete help for the patient, for the consumer.
Now, as a psychiatrist, what do you expect from the consumer in relation to his or her participation in treatment?
As a psychiatrist, we need the full cooperation of the patient in understanding their illness, understanding their medications and the side effects, and to tell the doctor as soon as possible if there are any side effects or breakthrough symptoms in relation to their illness. This way we can avert any hospitalization or deterioration of their illness.
Thank you very much, Dr. Chu.
Thank you, sir.
If it is clear to us that we are the right place for you to be, we may offer you an intake evaluation with one of our clinicians, a psychiatric evaluation with one of our psychiatrists, or a medication appointment with a psychiatrist or a nurse practitioner.
My name is Patricia Trainum. I'm a registered nurse working in the Outpatient Psychiatric Clinic. My role as a nurse in this clinic is to provide psych education for help for patients. My emphasis is on symptoms awareness, medication education, teaching patients to be able to correlate the action of their medication on their symptoms, be able to report efficacy of the medication to their healthcare providers. And I also, as a nurse, I also educate families as part of their role in helping the client, learning about their symptoms awareness, learning about other health-related illnesses and how it impacts on their emotional health. As a healthcare provider in a team, I'm very interested in knowing how family relates to the client and learns and understands the patient's illness. Importance to their recovery is to have a whole set of plans, a prevention plan, and that includes support systems, that includes learning your early warning signs of illness, and that is my role as a registered nurse to teach these things to our clients and to their families. I also correlate on the healthcare team with other team members and with the patient's private healthcare provider so that they can sometimes be able to relate to their medical illness, their medical doctor, and how their medical medications may impact on their health.
What can a consumer expect from working with you?
Well, hopefully a consumer can expect an empathetic, hearing, caring person who'll be there to educate them and the family, who'll be able to listen and help them deal with the stigma of mental illness, learning that it is a physical illness, just as diabetes or heart disease, and that they can manage it, not cure it, but be able to manage it with the help of the healthcare team.
Pat, what do you expect from someone coming to you for help that might provide the most positive outcome in treatment?
Well, the most important thing is being able to accept the information they receive, learn it, use it, and find an empathetic place to discuss their issues and their problems. And I expect the patient to be adherent to treatment, because treatment cannot work unless the patient is involved. They have to be also an advocate for themselves with the healthcare team so that they can get the best benefits of their treatment. And that includes bringing the family in to help them deal with any stigma or problems that family might have in accepting treatment.
Thank you very much, Pat.
You're quite welcome.
The assessment is not over after the initial interview. Most of you who have had intake assessments are reviewed before a multidisciplinary team shortly after the evaluation. Each one of our teams has a senior clinician as a team leader, at least one psychiatrist, a registered nurse, a social work assistant, and therapists. Your case will likely be presented by the person who did the intake.
Hello, my name is Monica Vinges, and I'm a licensed professional counselor and a licensed clinical social worker.
Hi, Monica.
Hi.
What does a licensed clinical social worker and licensed professional counselor do at Trinitas?
Well, here at Trinitas, we work with individuals, we work with families, and we also work with groups.
And what kind of work do you do with these individuals, families, and groups?
We do all kinds of therapy depending on the problem that the person has when they come. Like, for instance, some people are dealing with depression. Some people need to be referred to a doctor for medicine. Sometimes they need family situations where everybody has to get together and talk.
Monica, what can you expect from a consumer coming to you for treatment?
I would expect a commitment to the treatment. I would expect them to come weekly or however their appointments are set up. I would expect them to make all their appointments. It's very important that they're consistent in their appointments, not miss. So that would be my expectation. That they're honest and they're forthcoming, and they really do engage themselves and show that they truly want help because they're the ones who are doing the work.
Thank you very much, Monica.
You're welcome.
Group therapy is a very widely and wisely used mode of treatment in our clinic. We have a variety of types of groups and programs whereby group is either part of the program or could be the whole treatment format for some of you. Some of you are going to be asked to go to an orientation group at the beginning of treatment to teach you about therapy and the options that are available at this clinic. Others of you will be referred to one or several of our groups. Some of you may be referred to a group following a course of individual therapy. Some groups are ongoing. Some groups are time limited and keep the same members from start to finish.
Working with our staff will help you determine which is right for you. Some of you experience fear when you hear the word group, as if it is a lesser treatment method. We teach you to stop being scared and how to learn from the experiences of others. Group therapy can also be a mode of treatment that will be longer lasting than individual therapy. It is also our philosophy that group therapy is just as, if not more effective than individual treatment for many people. Just like with all of the other forms of mental health treatment, group therapy works best and faster if you make a commitment to come and you keep your appointments.
Hi, I'm Dr. Henry Jans, and I'm a licensed psychologist at the Adult Outpatient Unit of Trinitas Hospital.
Henry, what does a psychologist do at Trinitas?
Well, psychologists offer a number of very special contributions to our treatment team approach here at Trinitas, and I can highlight 3 of those right now. The first is that we have an expertise in developmental psychology, and we try to use that approach as we offer our psychotherapy services to individuals, to couples, to families, and to groups. Secondly, because of our training, psychologists have a strong affiliation with research. And as a result, we can understand research and we know how to use and apply it to the benefit of our consumers. We're also able to conduct research to answer important questions about what works best for our consumers in therapy. And lastly, what I can say is that psychologists offer a unique contribution in terms of their services in psychological testing. There, we're able to use a wide variety of testing instruments to gain a good insight into a person's emotional life as well as their thinking life. And the information that we gain, we can use for the advantage of driving and guiding the therapy services which we offer to our consumers.
What do you yourself provide in relation to services?
Well, as a psychologist here, I like to think of myself as a person who wears many different hats. I do offer face-to-face consultation and therapy services to individuals, to families, couples. I do a good number of group therapies also. I also take pride in working very closely with staff. I'm a supervisor of our trainees. I'm also a team leader where I kind of work with staff in terms of staying focused, making sure that we're directing our consumers to the appropriate services that meet their needs.
What can a consumer expect from treatment with you?
Well, I like to think that a consumer would get a very, very personal touch in treatment with me. I like to get to know the consumer as personally as I can in terms of knowing a bit about their history and about their current living situation, but also to learn about what goes on inside, what their emotions are, what their ways of thinking are. So I like to take my time with my consumers, and I like to give them some nice direction. I think for me they can expect not only empathy and warmth, but also some skill building. I like to offer homework assignments to my patients to keep them busy even at home outside of the therapy sessions. So they can expect to work, but in a very, very positive way, in the spirit of building themselves back up.
What do you expect from the consumers that are working with you as a psychologist? What do you expect from them in relation to providing the most positive outcome in treatment?
I expect consumers to offer commitment. I think it's a big commitment to come for therapy services, so I would expect consumers to keep their appointments, to have open communication with their psychologist. I want them to be able to trust me, so I expect them to use the relationship with me to build that kind of a trust. But basically I expect a commitment, I expect some hard work and honesty, and I expect a willingness to kind of go outside of comfort levels. Through that, they can anticipate better change in their lives in a positive way.
Thank you very much, Dr. Jans.
You're welcome.
Individual psychotherapy is frequently requested as a service. It is usually at the multidisciplinary team that this request is reviewed. It is not always the best mode to treat certain kinds of problems. This service, as noted, is provided by a wide range of clinicians. There are many styles of psychotherapy. Our treatment philosophy sees individual psychotherapy as a time-limited form of treatment that is based in scientifically verified methods. We expect that most problems that are treated can be resolved within 6 months of treatment. There are exceptions to this. Continued treatment beyond 6 months may have to be approved by the multidisciplinary team.
Hello everyone, my name is Mike Guglielmino. I'm the program director for the adult inpatient unit, but until recently I've been the program director for adult outpatient services for about 11 years. One of the things that I want to talk to you about is the value and benefits of group therapy. when patients come into our system, many think they'll see a psychiatrist or a therapist and begin individual therapy. And while that could be very useful for a period of time, group therapy becomes a natural outgrowth of an effective short-term individual therapy treatment. Sometimes individuals could even begin group while they're attending individual therapy for additional booster treatment. So group therapy has many advantages, and I want to go over a few of them with you. First, group therapy allows people to experience life the way we experience it most of the time, in groups of people. We live in families, we work in groups, we live in friendship groups, and these are the ways that a group can help people, because it helps to learn to cope with the real situations that we encounter every day. Individual therapy, while it helps people in a crisis, doesn't help people necessarily to gain the equipment they need longer term. And this is where group comes in. People in group will have had similar problems, and you can learn from each other in a group in a way that you may not be able to totally learn from a therapist alone. Group therapy allows people to practice new interpersonal skills, dealing with a conflict, or how you deal with stress right in the moment. And these are some of the advantages of being in a group situation with others. Groups allow people to get hope when they see other people improving. And groups allow people to be of help to others, which also ends up ultimately helping themselves. So these, among other things, are how group therapy, which we believe here is a very valuable treatment, can be invaluable to our patients.
Thank you, Mike.